time now for The Clash, in which we tackle the major stories of the day from opposing points of view. Tonight, should virtual GP appointments be scrapped? To debate this, I'm delighted to welcome a good friend of the show, Jamie Jenkins, former head of health analysis at the Office for National Statistics, who's concerned that they lead to missed diagnoses of health problems, and NHS GP Dr. David Lloyd, who says they should not be scrapped and they are a vital tool. Gentlemen, welcome to the show. Dr. Lloyd, tell me why you think face-to-face appointments should return.
Well, just to correct things, they already have returned. But I think that the thing we've discovered since COVID came along is that video consultations are an extra tool for us, that we can use it very well. Yeah. I would hesitate to compare your organisation with mine, but before COVID, and occasionally I'd appear on television, and I would have to drive into the studio, or a large camera crew would come to my surgery, and we would have an interview conducted that way. But I don't think I've been near a studio or near a presenter since COVID came along, and I hesitate to say I don't think you'd like to go back to the old ways yourself. It's interesting to see that a lot of patients, when given the choice now, are starting to say, well, can I have a video consultation or a telephone call rather than face-to-face? It started in a couple of practices around us, and the going rate at the moment is about 30% of patients would like a face-to-face consultation. The rest of them are very happy with video or telephones. So I think it's just a new way of working, and I can go on about figures and how awful general practice is and things, but I think basically we've discovered that there are a lot of things that you can do remotely, because I was taught at medical school, just like a lot of other doctors, that you can make a diagnosis on the history alone in 80% of patients. So 80% of the time you don't need to see a patient or examine them. That 20% do need examination, and we must get those patients in and see them. But if you're getting a good history, you can organise the care for that patient on a remote consultation.
Well, David, I've got to say, I would love to have you here in the studio face-to-face, but I do take your point. Jamie, have those virtual appointments been unnecessarily demonised, given the fact that so many of your encounters and exchanges with the doctor can be done over the phone or online?
So I think, Mark, there's definitely a change that has happened now over the pandemic. You know, people are working from home remotely more, and I'm sure there's kind of potential there for the GPs to carry on as they are. So the stats don't lie, I suppose. Before the pandemic, 80% of the appointments that were with general practitioners were face-to-face. That's down to 58%, and that includes all of the appointments that are going into the kind of the GP surgeries, which will include not just with the GP, but with some of the other medical staff as well. And I suppose the big problem we've got at the moment is twofold. They've kind of estimated that throughout the pandemic, we've got about 7.4 million people now in England who haven't joined kind of waiting lists because there's been no diagnosis either by the GPs or by the kind of the consultants at hospitals. And most of those are going to be probably better if you can get to see the GP. I think there's two problems we've got, Mark. There's the face-to-face aspect. It's a bit of a postcode lottery. It does vary across the country. You hear some really great stories from some GP surgeries, and you hear some really poor stories from others. So there will be a bit of hit and miss there. I think the main thing that we've got here is probably everybody's trying to get those appointments at 8 o'clock in the morning. They'll be on the phone tomorrow morning trying to get them. I think the big problem we've got, Mark, actually might be a bigger issue than just face-to-face or virtual GP appointments. It's actually getting a GP appointment in the first place, because there's been a lack of GPs. We know got fewer GPs in England and the rest of the UK than comparable countries in Europe. And I think that's the big problem, which is what needs addressing.
What do you think might be the correct ratio of virtual to face-to-face appointments?
Well, I think you don't really put in numbers on there. I think that the key thing is getting these appointments in the first place. So across the UK, we got 2.8 GPs for every 1,000 people. It's over 5 in Austria, Germany, Italy, Norway. You know, they've all got over 4. And Jeremy Hunt in 2015 was talking about getting more GPs, another 5,000 GPs by 2020. That hasn't happened. We've seen fewer medical student places in 2016 to 2010. So I think getting the face-to-face appointment is important, and I think that's important to get those diagnoses, for actually getting the appointment in the first place. And, you know, it's very difficult for the GPs out there, but even more difficult for the patients.
And David, yesterday, The Guardian reported A worrying spike in verbal and physical attacks on GP surgeries, reception staff and doctors themselves from an angry public.
Yes, I've never known patients quite so angry as they are at the moment. We have a constant stream of patients that are so anxious to get an appointment that they do get very angry. We're used to angry patients, of course, because when you're ill, you have very little patience, so we do have a lot of them. But yes, it is a big problem, and as you know, they've hit the news. Some practices had their GPs assaulted, a receptionist assaulted, buildings defaced. So yes, the anger is breaking out. But the big question is, do you want to have a society that looks after everybody equally in an NHS, or do you want to go towards a system like America where healthcare is rationed according to how much money you've got? And if you make that decision that we want to have an NHS and that is a priority for this country, then we've got to look at the ways of doing it. But there's not enough money around for everything. The fire service needs money, the police needs services. My brother-in-law is a judge. He says there are 60,000 cases waiting to be judged, and that completely puts a wreck on every family. There's such a huge, huge amount of backlog in everything that we can't just say in the health service, give us more money for the health service. We've got to think more intelligently about the way to do it. Patients have got to understand that there are not enough GPs and that there are better ways of consulting. Just like the fire service needs more fire engines and the police need more policemen, and we need more social care. There's lots and lots and lots of things that need to be done with the money we've got, and I don't know how you sort that out.
Now, the people responsible for those attacks on GP surgeries, receptionists, nurses and doctors, that's reprehensible and a disgrace. But notwithstanding those people who are breaking the law, it's understandable that the public are angry because the perception, David, is that GPs closed their doors to the British people for a year and a half.
Well, they didn't.
Well, they did literally, didn't they, David? They actually chained up the entrances to GP surgeries.
Because we needed to keep COVID out and because we found that there were better ways of doing things. But now things have opened up again, and all us doctors and nurses are all double vaccinated now. I'm triple vaccinated. So we are now much safer than we were so that we can start seeing patients face to face again.
But this decision to make GP surgeries COVID secure effectively meant closing GP surgeries. We have undiagnosed illnesses, many far more serious than COVID-19, especially cancer. People that didn't even bother going to the GP if they had symptoms. And this is a far bigger problem than COVID ever will be.
I agree. As your colleague has said, there are millions of patients that are waiting to have a diagnosis made. There are millions of patients on the cancer waiting list already. We do want patients to come forward. We want patients to come forward knowledgeable about their symptoms. We don't want them ringing up about minor stuff, because I think that there is a lot of that in general practice. We want patients ringing up with real symptoms and talking about their real problems, and then we'll sort them out.
David, Tesco's and Sainsbury's and Morrison's stayed open in the course of the pandemic. Why didn't GP surgeries stay open?
Because they didn't see patients with COVID. We had patients with COVID. Patients came in, and 5 minutes later they were in hospital and died. I had a queue of ambulances outside my COVID hub at one stage. We were at the front line of seeing patients with terrible diseases. We had to make absolutely sure our staff were safe, that we could see them. We had to have controlled conditions. And because of that, our health service has survived.
Well, David, some people, there is some speculation that up to 40% of COVID infections happened in hospitals or in a medical setting. The bottom line is the virus is highly transmissible. To try to control it and seal off GP surgeries appears to have failed. Well,
you're talking about the hospital there, and that's absolutely right. At the very beginning, we didn't know that patients had COVID when they went into hospital. And tragically, it got spread through the wards and it got spread out to people's care homes. And that was one of the terrible things that happened at the beginning of the pandemic. But no, we are absolutely committed to making sure that general practice starts up and starts properly. But this is an opportunity
Jamie,
to think about it again. We haven't got enough GPs. We could do it differently. So give us a chance to do it differently and provide a better service for you.
Jamie, I actually certainly don't blame the doctors involved, the nurses, the frontline NHS professionals who are, the best of this country. Absolutely. And what they've been through in the last year and a half, in many cases, is just a living hell and will never repay the work they've done. But what's your view about the decision of GP surgeries to actually close and also the attempt to make hospitals COVID secure? Because I've heard so many stories of consultant anaesthetists self-isolating at home because they were pinged in the middle of the pandemic because they were near someone that tested positive for COVID. And they're sat at home watching Netflix, baking banana bread, symptom-free.
Yeah, well, I think, Mark, when the virus took a hold last spring, we didn't really know what we were kind of fighting against. I think it's probably that my local GP surgery has been very difficult to get a face-to-face appointment, and they've been practically closed for the last 18 months. I think the very first few months, it was quite clear that something needed to be done. Nobody knew exactly what we were facing with. So I think the stats that are kind of clearly showing us at the moment is we've seen 70,000 excess deaths of people dying at home, fewer the people dying in hospitals because they obviously not getting those diagnoses, not getting the treatment that they need. And I think you've touched upon it, Mark, yourself, that since July this year, now we've started seeing excess deaths again. We're seeing COVID deaths going up as well, but half of the deaths are non-COVID deaths. So I know it's difficult for the GPs. I don't think we should be bashing the GPs for all of this. I think it all comes back down to 10 years ago, Mark, where there's been very poor planning in the system from government. You look at the HGV crisis we've got there. It just seems to be, we've got over a third of the GPs over the age of 55. If we don't address the problem now, we're going to be having the same discussion in 10 years' time.
Yes, I mean, my personal view is an attempt to control the virus across the country has failed. We've had lockdowns and we've had other COVID measures, and we have, sadly, one of the highest COVID death tolls in the world. So I would suggest these interventions have not worked on a nationwide level, on a societal level, and I don't think they've worked in a healthcare setting either. We've emptied hospitals. We've asked important medics to stay home and self-isolate without symptoms. But obviously, that's just my view. We are where we are. Moving forward, Dr. Lloyd, what are your thoughts about how long it's going to take for GP services to return to something of where they were pre-pandemic?
Well, I don't think they should return to where they were pre-pandemic. I think we've learned that there are new ways of doing things. We've also had, I can be very boring about primary care networks and all the things that have been introduced over the last few years, but it is a time where we're looking at doing things in a different way. We've got to get back to personal responsibility for GPs. We've got a whole pile of people that aren't GPs that are looking after patients, district nurses, palliative care nurses, A&Es and ambulances seem to be the first port of call for people, when what we should be getting back to is GPs being there for their patients the whole time. And that means that you've got to have a better system so that the patients who need a GP have got a GP to go to and they can do it easily. So that's the big challenge. And so we've got to change the way we do it. It's not going to be the old ways. It's going to be a better way.
And do you think, and I understand why Jamie was reluctant to offer numbers in terms of what the proportion of virtual to face-to-face would be, but have you got a sort of rough idea, David, of the sort of landing point of how things might look in years to come?
Well, as I say, the numbers that are coming in at the moment suggest that 30% of patients want a face-to-face consultation. Whether they should have it or not is I'll have to come back to you on that. Yeah, that's what we're aiming for at the moment, 30%.
And I think we can all agree and pick up on Jamie's point that what's most important is an appointment of some description with a GP. Jamie, a quick word while I've got you on the modelling. The Spectator have actually published more modelling courtesy of Sage and the NHS, which appears to have been wide of the mark when it came to Freedom Day on the 19th of July in England, schools going back, no worrying surge. And of course, we saw early in the pandemic predictions of 500,000 dead from COVID, courtesy of Imperial College. So at this point in the pandemic, what's your view of modelling, and does it have a case to answer?
Well, I think at the very start of the pandemic, we needed some kind of modelling going forward. They've been proven way off the mark time and time again. Even the most recent ones, Mark, that were published for the Prime Minister introducing his winter plan was suggesting that, it was on the front of the Guardian that we might have 7,000 hospitalisations a day by sometime in this month. And to get that kind of level, you need 300,000 cases a day. These are making the front of the national newspapers. They're kind of scaremongering the public with regards to some of these models. The good news is that we are nowhere near that. In fact, we've started to see cases of hospitalizations going in now coming down, and we haven't seen the big spike that people thought we may have got with the kind of the schools kind of reopening and people going back there. So I think where we are at the moment, Scotland had kind of had an earlier spike with schools going back. Things are coming back down, but the models, Mark, they've lost a lot of credibility. It's very difficult to model this virus, but time and time again they've been incorrect, and they still keep going back to the same modelers, coming up with the same answers.
Just from a statistical point of view rather than a scientific one, Jamie, looking at where we are in the numbers, does it make for good reading? I mean, can we be hopeful that we're through the worst of this?
I think so, Mark. It's obviously we've got the winter months coming up, and one of the things that, if you remember before the pandemic, the NHS is overrun every single year, and it's inevitable that it probably will get overrun this year because there's a pandemic kind of still going on. But in terms of where the numbers will, looking at the way the trajectory is at the moment, it's going to be very difficult to get anywhere near these big numbers. It would mean that you're going to have massive lockdowns that people will talk about again. And you look at Australia, they've got into this lockdown. They've been in lockdown for ages. Cases are still going up there. So I think what we need to do now, Mark, is look back over the last 18 months. What have we learned? What things are happening? And sometimes you start seeing cases coming down, and we've seen that in Scotland and in Wales and England when we've opened up as well. So I think the virus is very difficult to model. We do need some kind of models, but I think at the moment things are looking pretty optimistic. Because remember, the majority of people are vaccinated or have some antibodies from pre-infection. So I think we're going in with a lot better this year than we were last year.
Very, very briefly, just a few seconds, David Lloyd. What are your thoughts about the winter that lies ahead? Clearly, it's going to be a challenging time for the NHS. Can it cope?
Yes, in a short sentence, it's going to be absolute hell. But we've got to think very carefully about it. COVID is one part of it. The respiratory viruses are another. And the flu is another bit. But just a big plea, please, to all your viewers, if you're not vaccinated, get vaccinated. It really does stop you from dying from COVID. And especially a big plea, because this is the big one. If you're pregnant, get a COVID vaccine. There's a lot of reluctance out there. And yet the ITUs are full of COVID pregnant women. So please get a vaccine if you're pregnant.
Dr. David Lloyd, thank you so much for joining us. NHS GP, a pleasure, whether in the flesh or virtual. Also, Jamie Jenkins, former head of health analysis at the Office for National Statistics and now a commentator on all matters medical stats. Thank you to you both.